Okay, thank you so much for joining this live stream event. I'm sorry we're not meeting in San Francisco right now. My name is David Hubacher and I work at FHI 360. I'm a member of the steering committee for the IUD Symposium. My colleagues on this committee include Carolyn Westhoff, Anita Nelson, Diana Blythe, Jim Saylor, Ricky Liu, and Ian Bishop. The symposium's coordinator is Rachel Farrat. I would like to thank our supporters. We could not put on a symposium without them. For this live stream event, Carolyn Westhoff of Columbia University and I are the co-hosts. After my brief presentation, Tina Raine-Bennett of Kaiser Permanente will moderate the technical session, and then Carolyn Westhoff will wrap things up.
Thank you, David. So as David has shown us, access to and use of IUDs has expanded. Indeed, more women worldwide are using IUDs to plan their families. Today, our panel will provide timely and informative information about key factors that should be considered as we attempt to meet the family planning needs of women who use IUDs in an increasingly complex landscape. So all women who receive an IUD will at some point, for various reasons, need an IUD removal. So this is an important topic that we want to integrate in our understanding about use of IUDs. While clinicians may perceive IUD removal to be a relatively simple procedure, the reality is there are many personal and social factors that come into play. This has always been true, but now, more than ever, with the current stress of the pandemic on individuals and the healthcare system, it is important to recognize the factors that can shape the experience of women seeking IUDs and women who desire to have their IUD removed. Next slide, please. So before I introduce our panelists, I just wanted to give you some more information about this live stream. So we have two event managers who are managing things in the background, Rachel Farrat and Sarah Godfrey. We will have two American Sign Language interpreters, Emily Shankar and Amanda Kernahan. And hopefully you can see Emily on the screen right now. We will, all participants are muted for this seminar, and we will hold questions until the end of all of the presentations by panelists. So please submit your questions for speakers using the Q&A function at the bottom of your Zoom screen. So now I'm going to introduce our panelists. And so if you would turn on your video so we can see you, that would be great. Next slide, please. Okay. So our first panelist will be Diana Green Foster. She is a professor at the UCSF Department of Obstetrics and Gynecology and Reproductive Sciences and the Director of Research at ANSWER in the UCSF Bixby Center for Global and Reproductive Health. She studies the consequences of unwanted pregnancy on women's lives and the effectiveness of family planning programs and women's contraceptive feature preferences. Dr. Foster will be discussing what women want and their desire for control over IUD removal. Our next panelist will be Jennifer Amico. She is an assistant professor at Rutgers Robert Wood Johnson Medical School in the Department of Family Medicine and Community Health. She is the co-director of the Rutgers Reproductive Health Care and Advocacy Fellowship and the co-medical director of Southwestern's Women's Surgery Center in Dallas, Texas. Dr. Amico will be providing information on patient and provider perspectives on access and obstacles to IUD removal. Our next panelist will be Jillian Dean. She is the Senior Director of Medical Services at Planned Parenthood Federation of America. She is responsible for supporting Planned Parenthood affiliates nationwide in the delivery of high-quality, evidence-based healthcare. She provides clinical care and training at Planned Parenthood of Greater New York. She is an associate professor in the Department of Obstetrics, Gynecology, and Reproductive Sciences at the Icahn School of Medicine at Mount Sinai, where she founded and directed the Fellowship in Family Planning. Dr. Dean will be giving us insight into IUD care during the COVID pandemic and a case study from the U.S. epicenter, New York City. Our presenter following Dr. Dean will be Gathari in Durango. He is an obstetrician and gynecologist who has a public health background with 20 years of experience in health systems strengthening, technical support, service delivery, research, and program management in sub-Saharan Africa. He is the technical director for family planning, reproductive, maternal, neonatal, child, and adolescent health at Japigo, Kenya. Dr. Ndurango has successfully led complex, large-scale integrated health projects in Kenya and Zambia for Japigo. He has also led the expansion of hormonal IUDs to the public health sector in Kenya in partnership with International Contraceptive Association Foundation and the Ministry of Health. Dr. Ndurango will be discussing international perspectives on IUD services during the COVID pandemic. And finally, our last panelist is Dr. Mike Polakar, who is a professor emeritus of obstetrics, gynecology, and reproductive sciences at the UCSF School of Medicine. He is the clinical fellow for the National Family Planning and Reproductive Health Association and a senior medical advisor to the California State Office of Family Planning, Family PAC program, which is the state's only family planning funded program. Dr. Polakar will be rounding us out and informing us of changes in reproductive health care delivery in the U.S. in response to the COVID-19 pandemic. So at this point, I will turn it over to our first presenter, Dr. Diana Green Foster.